who are here get the chance to see the entire presentation. Good morning, everybody. My name is Oren Gur. I'm a criminologist by training, and I am director of the Data Lab at the Philadelphia District Attorney's Office. Today, we will be sharing a potpourri of information based on months of work, collaborative work among the different offices and stakeholders who are here on today's call. I will put up a PowerPoint slide and we will get to it, but give me 1 second and I'll get this PowerPoint slide up. You should now be able to see the slides. Somebody will yell at me if you can't. So today's presentation is titled An Interagency Public Safety and Health Approach to Analyzing Shootings and Gun Crimes in a Major US City During COVID-19, What the Data Show. Appropriately, as Philadelphia is the host, we are focusing on what's been happening in Philadelphia, but we'll also put it into the national context. We have 8 presenters today who are going to be walking us through really interesting slides that give different perspectives on how we are looking at these issues. We have Ruth Abaya, Dr. Ruth Abaya, Injury Prevention Program Manager at the Philadelphia Department of Public Health. We have Connor Bell, Senior Policy and Data Analyst, the Defender Association of Philadelphia. Ryan Fisher, All But Done, Data Manager, Office of Policy and Strategic Initiatives for Criminal Justice and Public Safety in the City of Philadelphia. ADA Assistant District Attorney Michael Hollander, Director of Analytics and Assistant Director of the Data Lab at the Philly DAO. George Kikuchi, Law Enforcement Analyst Manager and at the Intelligence Bureau of the Philadelphia Police Department. Michelle Kilpatrick, Director of Operations and Assistant Director of the Data Lab at the DAO. Tyler Tran, Senior Data Analyst at the Data Lab at the DAO. And Wes Weaver, Assistant Supervisor of Analytics at the Data Lab. I think, as the logos at the bottom show, this has been an interagency collaborative approach, and we're just very excited to just be working on this together. In my time in Philadelphia, which has been 3+ years in city government, I haven't been part of a collaboration quite like this. So I hope you will see the merits of this kind of close work together. This is a general overview of what we'll be getting into, and then I'll get out of the way. So we're talking about an overview of shootings in public health in Philadelphia in 2020, 2021. And then we're going to talk about what we call the Philadelphia Interagency Research and Public Safety Collaborative, or PURPOSE. We'll go over the purpose of PURPOSE, some preliminary high-level findings based on data we do have, and then future directions of how we can get beyond official statistics and administrative records in understanding some of the issues we're dealing with. Ruth, take it away.
Thank you, Oren. Good morning to everyone. Thanks for joining us. So we wanted to start by putting the information we're going to be providing today in the national context. And I think this will probably come as a surprise to no one. Well, we certainly saw that 2020 was a very difficult year for homicides in the United States and for firearm violence in the United States as well. So what this demonstrates is cities that saw, for the most part, all but one of these cities that have the top 20 numbers of total homicides for the year 2020, all but one of them saw an increase from 2019 to 2020. And there was quite a range in to what degree that increase was seen. So Philadelphia, for example, had about a 35% increase as compared to Louisville, which had about a 92% increase from the prior year. So although the numbers themselves, tell a concerning story, what we see is that for some cities, the degree of increase was greater than others. Overall, nationally, there was a 20 to 30% increase, depending on which source you look at, in murders on a national scale. And Philadelphia was second in overall number of murders among the 60 cities that were represented in that year. So this rise is likely multifactorial. There are a lot of reasonable explanations for why this might have happened. Many may have heard about the increase in gun purchases and first-time gun purchasers. That was definitely a national trend and certainly something that we saw in Pennsylvania as well. But obviously the threat of COVID-19 and the lockdowns that were associated with it, the public health measures that needed to be instituted, as well as the economic and social disruption that it caused, likely contributed to these trends. So just to focus a little bit more on Philadelphia, this goes back to 2007, just to give a little bit more context. Philadelphia has had kind of a chronic problem with firearm homicides. This particular graph looks at both fatal and non-fatal shootings, in part to make the point that the burden of disease is overwhelmingly non-fatal shootings. So non-fatal shootings make up the majority of people who are injured by guns at a ratio of about 4-to-1, pretty consistently for Philadelphia. But what we can see here is that we had a slight decrease in 2013, 2014, and then we've been struggling with an increase ever since then. And the city took a pretty aggressive and targeted approach to focus on firearm homicides in 2018. And since then, we've continued to see an increase, but 2020 certainly outpaced what we had seen in the prior more than decade by quite a bit. And so 2020, as reflected in the prior slide, was a very challenging year for our city. So I think it's very much worth talking about who this trend is affecting and the fact that this is not new. So overwhelmingly, shooting victims in Philadelphia, again, looking at both fatal and non-fatal victims on the left, are young. So the people who die of firearm violence tend to be less than 30 years of age. The peak age, just broken down by CDC categories, was 20 to 24 in the year 2020. And they're also overwhelmingly non-Hispanic and Black. And so the graph on the right demonstrates the demographic breakdown. We just look at 3 demographic groups just based on the data that we have available to us. Groups that are not represented in that legend have much smaller numbers, but it should be clear they are not completely absent in this particular trend of firearm violence in our city. Overwhelmingly, though, the burden of disease is carried by non-Hispanic Blacks, with Hispanics and then non-Hispanic whites coming in second and third, respectively. And this trend is depressingly consistent. And so from 2015 to 2020, what you can see is non-Hispanic Blacks have been the bearers of this particular public health burden for a while. So when you combine all of these factors, and this is looking specifically at non-Hispanic Black males, what you can see is that the people who are being affected by this problem are non-Hispanic Black males who are young. And this is in this moment of kind of recognizing the long-term effects of structural racism. This is, I think, a problem that definitely bears highlighting. So one of the things that our team felt strongly about doing is putting this trend in the context of what else is happening in the neighborhoods and communities that we live in. Philadelphia is known as being, as many of you heard in the Tuesday session, a city of neighborhoods. And what this looks at is zip codes. But what you can see here is that the graph or the map on the left is non-fatal and fatal shooting victims by zip code in 2020, and the darker blue connotes higher numbers of shooting victims. And the maps to the right of that all demonstrate different socioeconomic factors that have been shown to be related to firearm violence. And so from left to right, we show poverty, we show unemployment, we show lack of high school diploma attainment, and we saw those not enrolled in school or employed. The term that we use for that is opportunity youth. And we demonstrate specifically ages 16 to 19 in this particular map. And what you can see here is that by and large, the maps have overlapping areas of dark blue, right? So the areas that have these higher levels of all of these socioeconomic factors are also the areas where we see higher numbers of shooting victims. And so this, I think, tells a story that definitely needs to be investigated more as we think about what might predispose people to being exposed to this public health crisis. So this is some work that was done by our colleagues at the DA's office, showing a very similar story, but for a different population. So rather than all shooting victims, this demonstrates people who have been arrested for shootings, which is the cohort that we'll be focusing on today. And you can see that the story is not much different. So if you look at the places where people who are arrested for shootings live, their homes, that is the map on the left. In red, in dark red, are the areas that have higher concentrations of these individuals. And the maps on the right demonstrate unemployment, educational attainment, poverty, and then some other factors such as child lead levels or prevalence of mental illness or lack of health insurance or eviction rate or low incomes. And what you can see is, again, a pretty significant overlap in the regions of the city. We generally refer to them as north-northwest and then north-northeast rather, and south-southwest, that are seeing multiple public health and social crises at the same time.
Morning all. So briefly, we wanted to touch on really, as Oren mentioned earlier, the purpose of purpose. And how we kind of came to be. So in early September of 2020, City Council had reached out to the DA and also the Philadelphia Police Department in order to alert them to an interest in investigating gun violence in Philadelphia in kind of greater depth. And this led to this City Council resolution wherein they expressly stated that they wanted to review and examine the perpetrators of the most recent 100 acts of shooting in Philadelphia. And so ultimately it led to the creation of the panel you see before you. And really what's happened as a result of kind of this initial request is that we've more formalized our interagency collaboration. And so this has helped with data sharing, where there were, historically kind of silos of data and analyses that existed in their respective departments, and made this much more of a cross-agency collaboration, singularly focused around analyzing gun violence. And ultimately, after presenting some of this information to City Council, we decided as a group that we were going to kind of stick together and have kind of created more of an iterative, evolving research agenda that also brings in other departments in the city where necessary, and also collaborations with other non-city departments and organizations and entities, some of which will be touched on later in regards to some of the future research items that we're hoping to pursue. And now I'll turn it over to Michael Hollander for some discussion of some findings.
Good morning, everybody. So I want to start by saying that maybe one thing that's useful to start with too is that this collaboration has been fantastic, and it's not that we're a monolith in this collaboration. We are working together, but one of the good things is that we all come from with different perspectives, and so we're presenting data, but sometimes we have, using different data and different views on the data, different views on what's happening, which I think is a strength of the collaboration. And this collaboration's gone on for 7 months at this point, and hopefully will continue. And one of the things that's been excellent is the breaking down of the silos, the sharing data, to making sure that we're all working off of the same data sets as we make and draw different conclusions. And before I get into some of those conclusions, I want to just start with some of the limitations that we have in our study. And this is important for us all just to have at the outset in our heads. The first is that there's really strong selection bias in this study. And what I mean by that is that of the shootings that happen in Philadelphia, only about 20% of them lead to an arrest. And the conviction rate amongst those arrests hovers in the range of 60 to 75%, depending on the year that you're looking at. It's a little bit higher for homicides, a little bit lower for non-fatal shootings. But what that means is that for every 100 shooting events, only 20 people are arrested, and only between 12 and 15 of those people are convicted and, from a legal standpoint, found to be culpable for the shooting. So that means that we're missing information on at least 80 people who are involved in shootings, if not, 85 or closer to 90 people. So we have this really small window into who we're looking at. And we have to think about what the correlation is between the people that we're arresting, those 20%, and then the other factors that we're finding about them in our administrative data. I put out there, and I don't have any evidence to prove this at this point, but that the very things that make these people who we're arresting show up in our data are also the things that lead to them getting arrested. And so it's possible that the other 80 people that are not being arrested out of every 100 shooting incidents look extremely different from an administrative data standpoint. Maybe they have no prior criminal record. Maybe they have no involvement with other non-criminal legal systems within Philadelphia. The other thing is that administrative data, as we all know, is extremely limited. And it's limited in a number of ways. One way, which I actually didn't write down here, is that the administrative data system only tracks people who are engaging in things with the city or with state government. If you are, for example, wealthier and you can go to a private doctor, private mental health services, you go to a private school, you are not going to show up in this administrative data. So what we're really doing is we're only tracking specific types of people and specific types of problems. And we should keep remembering that and keep that in the back of our heads, that we're only looking at a very small group of people, or maybe a large group of people, but we're missing a large group of people. And then the other is that administrative data is really just a small window into what are very complex and rich lives. People might have all sorts of histories of different kinds of abuse, exposure to violence, loss of family and friends, other kinds of trauma that we can't measure in our administrative data and we can't know about. It's possible that somebody's neighbor died, somebody's cousin died, somebody's best friend died, and that's not going to show up in our administrative data, even if we could track, for example, that a parent died or a sibling died. The same thing, there could be lead exposure for an individual in early childhood. There could be mental health problems that are untracked. We don't know what someone's recent family status is, their employment history, and so on. And all of this is just to say that, again, what we're looking at here is a minor window into what is a very complex question. And we've tried to expand that window by looking beyond criminal legal data. But this is something that's just important, and I want to make sure that we're all holding in our heads as we look at this. The Philadelphia Police and the District Attorney's Office both separately looked into and came to similar but slightly different numbers about people's prior criminal legal system involvement. The numbers that you're seeing here are the result of a review of arrests and court cases since the year 2000. The year 2000 was chosen partly just because the size of the data set gets too big at some point to be able to do anything useful with, but also because there's limitations in some of the administrative data systems we have prior to those years. But what you'll see maybe isn't so surprising. This is primarily men, they're primarily young, and many of them have some sort of a prior legal system involvement. And again, this is just among the 20% who are arrested. So 3/4 of them have been previously arrested. Half of them have been arrested more than 3 times. Almost half of them have had a conviction. 4 out of 10 have had a felony conviction. There are some other common attributes that are a bit less common, but still somewhat common. People have, it's fairly common for people to have cases with prior firearms charges, to have an open felony case at the shooting, to have been previously incarcerated, and so on. So we know that at least amongst the people that are arrested, there is a pretty strong nexus between prior criminal involvement and the shooting. And then in terms of the types of things that people have been charged with in the past, the most common: drug sales, then drug possession, aggravated assault, robbery, simple assault. These are probably unsurprising. And Oren, if you'll go to the next slide, they're unsurprising because these are the most common things that anyone in Philadelphia and probably in most cities in this country would be arrested for. The highlighted ones are the top 4 things that people have been arrested for over a similar time period in Philadelphia. So it's not surprising to say that the people arrested for shootings are also arrested for those things. And what that means, and Oren, if you'll go to the next slide, what that means is that this information is helpful. It's helpful to understand people, but it doesn't tell us very much about people who are likely to be involved in shootings. And what I mean by that is that if you start working backwards and you say, okay, somebody was arrested and they're now in front of us, or maybe they haven't been arrested, we just want to identify people to provide some sort of services to prevent future shootings. If you start combining some of these attributes, and I just took a handful of them here: male, under 35, prior drug sales or gun possession charge, we're actually only matching about 31 of the most recently arrested people for shootings. I said about 31 because my numbers changed a little bit just yesterday, and I want to be careful that it's not exactly 31. It could be 32 or 33. So we're only finding about 1/3 of the people who were recently arrested. But if you look at those same attributes against everyone that has a criminal record in Philadelphia and this was over the last 10 years, there's 16,500 people who share these same traits in Philadelphia. And so it's very difficult to use this information, at least this criminal legal information, to identify those people who are at risk of being involved in a shooting. And so I want us to be really careful about trying to use this data and say that we can identify who is going to be involved in a shooting. And one of the things that we've done and that we're working on doing to learn more about people who are involved in shootings. And this is what Ruth and others are going to talk about, as we've started to look outside the criminal legal system, what other administrative data might tell us. And I'm going to pass it to Ruth to continue that conversation.
So we just wanted to offer an introduction to what data source we are going to be using to try to provide some additional context for this group of individuals. And we're going to be using a data set called CARES, which integrates information from multiple administrative data sets throughout the city and has a number of advantages and has significant value in doing this kind of work. So it links individuals across data sets, and it can be used for a number of things and is used for a number of things in the city of Philadelphia, including coordinating efforts between departments, evaluating and monitoring active programs, especially programs that are being co-managed by multiple agencies or departments within the city, and then also conducting research on outcomes that affect multiple departments. And so there's some great work being done in multiple cohorts, including children less than 5 and older adults, to try to understand what outcomes are relevant to the programs that multiple agencies might be providing to those specific cohorts. So just a little bit about why we like the idea of using CARES for this analysis. Again, it provides contact outside of just criminal justice history, which we found to be a very important missing piece in looking at these individuals and in their histories. And it links that data and dates of service across data sets. Just of practical value, there are existing protections and confidentiality agreements that allows it to be a safe source that protects the individuals that we're talking about, which is of integral importance. And it also allows us to kind of establish a recurrent data pool so we can do ongoing analyses over time. One of the things that's important to note about gun violence, I had mentioned in my earlier slides, some of the more entrenched features of gun violence in Philadelphia, but we also recognize that it's a dynamic problem. 2020 and COVID-19 certainly proved that fact. And therefore, we need to be prepared to reevaluate our conclusions in regular intervals. And CARES allows for that type of activity. And then it also allows us to link with external data sets, which is something that we did for this analysis. And so there are all of these existing sources of data, which are represented in the figure that's on the right, everything from lead exposure to your exposure to street outreach, substance abuse, mental health, supportive housing, out of school time, child delinquency and dependency, local incarceration, et cetera. But we can also take a completely external data set and link it using the same identifiers to the same cohort of people, and then start to say more about what those individuals have been exposed to, even if that data set is not already in CARES. And so that's a pretty significant advantage of the data set for us as well. So there are some really critical elements that are not in our data set. And this, I think, speaks a little bit to future directions and to collaborations and ways in which we can grow the work of purpose going forward. So we don't have school district data. A lot of the work that we do in injury prevention includes a review of individuals who have been decedents of gun violence. And so we have a homicide review team that we run. And in that work, we've seen that a lot of people who end up being decedents of gun violence, victims of gun violence, had very early involvement with some of these systems, including the criminal justice system, at the time when they ostensibly should have been in school. And so what do we know about their exposure in school? What do we know about the types of learning plans that they had? What do we know about their truancy rates? What do we know about other types of services that they may have received in that setting? And right now we can't currently link that. And so there are ongoing partnerships between the city and the school system that are being developed, but this is, I think, a major piece of data that we're interested in continuing to grow. We don't have employment data. So we have employment data that we can get from the census, and then we have the ability to look at whether or not people got some services that are relevant to unemployment, but we can't actually say much about detailed employment, which is an important factor and maybe unique to poverty as a risk factor for involvement. And so something that we are definitely interested in as well. Hospital data. So for the homicide death review that I made reference to before, we're able to get detailed person level hospital data, but that information is not available for the larger cohort. And so the ability to review points of contact with local hospitals, many of which have services that are relevant to being a victim of violence, for example, I think is a critical missing piece. And then maybe the part that is most important for this individual or for this group of people that we're talking about is involvement in products and services and programs that are specifically targeted towards violence reduction and prevention. So we can't say from this specific data set whether or not someone was recruited to, for example, Philadelphia's version of the group violence intervention program, or what used to be known as focused deterrence. We can't say from this data set whether or not someone was recruited to a hospital-based violence intervention program. And we can't say whether or not they were ever included in any of the cure violence model programs or program in the city of Philadelphia. And so this is where the value of linking external data sets comes in, but the ability to say that we are or are not capturing people who go on to be arrested for shootings, I think is critical.
So Mike and Ruth have both spoken a bit to this, but a lot of the work that we're doing is looking at characteristics of people who've been arrested for shootings. And like Mike mentioned, only about 20% of shooting incidents over the past few years, between 20 and 25%, have had arrests. So we really wanted to look at, what are the characteristics of those incidents where there were arrests versus characteristics of the incidents where there are no arrests. So this graph on the left is showing a relationship between just the number of incidents per month, number of shooting incidents per month, which is shown in blue, versus the shooting clearance rate per month, which is shown in red. And I will note that, this is just whether an incident had an arrest or not. It doesn't speak to whether anyone was convicted for a specific incident. But one thing we noticed when we were looking at this was that there seemed to be an inverse relationship between number of shootings and the shooting clearance rate. So when there were more shootings, fewer of those shootings were cleared. So when we're looking at this, like one thing we're thinking about is, does this speak to investigator capacity or caseload? What other factors could this speak to? So as we dug into this a little bit more, we looked at several different characteristics of an incident and of victims. So victim characteristics such as victim race, sex, or age, different characteristics of the incidents such as motive, which we only looked at for fatal shootings, time of day, whether it was indoors, outdoors, etc. We looked at some neighborhood attributes, and then we also looked at information about police. So looking at which unit responded to specific incidents, the number of detectives in each of those units, and some proxies for experience that different investigators might have. So just as some high level findings from what we're looking at, for non-fatal shootings, we found that there were different attributes about victims that made the incidents more likely to be cleared. So shootings with female victims were more likely to have arrests than shootings with male victims. Shootings with white victims were more likely to have arrests than shootings with Black or Latinx victims. Indoor shootings that occurred when it was light outside, and shootings that occurred on Mondays were more likely to have arrests than the comparisons. And then when we're looking at information about police, we found that shootings where the Special Investigations Unit responded had higher clearance rates than shootings where line detectives responded. And also that when there were more detectives in a unit that responded to an incident, that incident was more likely to be cleared. And that's just for non-fatal shootings. And I'll note that a lot of these results are backed up by things that have been found in the literature in other jurisdictions, but a lot of past research has only looked at fatal shootings. And so this is trying to add to that. So for fatal shootings, our findings are similar in some ways. We found that shootings with white victims and child victims were more likely to be cleared than the alternatives. Similarly, shootings where it was light outside were more likely to be cleared. And then we were also able to look at motive for fatal shootings, which we did not do for non-fatal shootings just because of data availability. We found that when the suspected motive by police was a domestic incident, there were higher clearance rates versus lower clearance rates for drug incidents, retaliation, and other. And then sort of unsurprisingly, when the motive was unknown, there were lower clearance rates for those shooting incidents. Now I will pass this to George to talk a little bit more about the implications of this work.
Thanks, Tyler. So although we deem this as preliminary findings, but we wanted to share these results in hopes of getting more feedback or thoughts and so forth as part of this conference. We'll definitely be interested in taking this analysis to the next level by, for example, examining additional neighborhood characteristics besides, let's say, a median income at the zip code level. Maybe we should also add the number of violent crimes or like a neighborhood composition, neighborhood stability, and so forth. We also wanted to examine or fine tune the indicators of a caseload or the volume of shootings in a particular organizational unit. For the preliminary analysis, we did include shooting counts, but obviously these detectives handle cases or crimes other than shootings too. So we'll definitely be interested in taking into account additional caseload, but given the nature of crimes or cases, probably we'd have to be thinking about different ways of weighting different crime types in a case assignment, but that would be something that we'd be interested in further examining. Existing research on clearance definitely goes beyond simply by looking at yes or no case outcome, but instead, or in addition to that, existing studies have also examined time till clearances. So that would be something that we may also be we may be interested in looking at too. And given that we have both neighborhood characteristics and organizational characteristics, perhaps we should be using multi-level modeling. Or what we may also be interested in is, in addition to statistical significance, I think we are, in order to make this findings practical, I think we are interested in identifying what matters the most, what are the more important factors than others besides, again, statistical significance. So overall, we'll be spending a little bit more time on examining the robustness of the findings. And in order to further understand and properly interpret the findings, we may also be looking at additional data collection, or we may be pulling a sample of cases, again, in order to understand the context behind the numbers that we are seeing. But nonetheless, again, even though this may be preliminary findings at this stage, I think the results are promising, especially for someone working for the police department, because they seem to be pointing to something actionable. In particular, regardless of a various combination of variables in the model, organizational characteristics seem to be one of the most strongest predictor of a case clearance. Then obviously the implication is maybe we should be reviewing the organizational structure and or like a caseload assignment standard operation procedure. So we may be able to look at those like a policy issues too as potential implications. Or perhaps if the capacity really is, and this again, this may not be like a no-brainer, but again, if the capacity really is the issue, even though this may go beyond just detectives' work, freeing up police resources perhaps could also be a practical venue that we can pursue. For example, the PPD is in the process of engaging non-law enforcement responders for non-emergency mental health related calls, and other jurisdictions have done it too, but that could perhaps indirectly help in supporting the police resources. And if you could go to the next slide, I want to give a quick overview of the second research topic that we are pursuing within the context of gun violence. Specifically, I want to show two graphs in order to provide the context or the background of this study, specifically by looking or specifically that looks at weapon offense or VUFA case disposition. The first graph that I want to show is the trend of shootings, homicides, and the number of weapon offense arrests. As has been mentioned previously, the number of shootings and homicides are going up since or in the past 5 years or so. So the blue bar indicates, I'm sorry, I apologize. The red lines and yellow lines indicate the number of homicides and shootings. And as you can see, in the past 5 years or so, it has been going up. Okay. But what adds to this graph is an additional element, the number of gun arrests that has been happening in Philadelphia, which is represented by blue bars. And you can see that the number of gun arrests has also been going up in the past 5 years or so. And in fact, going beyond the 5 years and going back to 2007, these three factors yearly trend almost mirror each other. As one goes up, the other goes up. As one goes down, the other goes down. So perhaps an implication is that, and again, this may not be anything surprising, but the number of guns on the street that the police is coming across indicates that higher likelihood of lethal violence, or simply more guns on the street, more victims. If you could go to the next slide. And the second context behind this weapon offense case disposition analysis that I want to briefly discuss is, in addition to the number of crimes happening, this graph tries showing what's happening on the criminal justice system side. As has been mentioned, the blue bars indicates the number of gun or weapon offense arrest. And as you can see, in the past 5 years, again, it has been going up. But what's happening in the system side is that over the course of past 5 years or so, as indicated by yellow line, the percent of conviction on weapon offense has been consistently declining. On the other hand, as indicated by red line, which represent the percent of dismissed or withdrawn cases, the dismissal or withdrawn has been going up consistently. And additional element is the bottom line, the green line, which indicates that the percent of acquittal, which hasn't changed much in the past 5 years. Yeah. So I think what this means is that the police is making more and more arrests, but we are having difficulty getting a conviction. Yeah. And obviously the question is, what is happening or what is contributing to this trend? But an additional context that we should also keep in mind is the challenge that the system has faced uniquely in 2020, which is a court closure because of the COVID. Typically in each year, about 1,000 cases or so are disposed on VUFA cases. But in 2020, less than half, or like approximately like 500 or so cases only were disposed because in the majority of times the courts were closed. Yeah. What this means is that as police are making more and more arrests and more cases are piling up, those cases are not processed, and the reality is there are thousands of, I believe it's somewhere between like 2,000 and 3,000 cases of gun offenses that are pending and that are open. So that's an additional context that the system is facing that we should also keep in mind. But again, the bottom line is more arrests are made while the conviction is going down. And again, the question is, what is happening? What is contributing to this pattern, which started this collaborative research with the PPD and DAO on the case disposition analysis. Next slide, please. So specifically, we're going to be looking at arrest origin, circumstances, or the characteristics of people who are arrested, or the evidence available at the time of arrest in comparison to case outcomes. But we will also be interested in looking at reoffending rate and a few other indicators too. But similar to case clearance rate or case clearance study, even though a lot of people involved in this research project are like quantitative researchers, I think it's always important to look at the qualitative aspect. And hence, we will also be conducting a supplemental analysis of like a case review, specifically by focusing on declined or withdrawn cases. This study is still in early stage, and we are almost close to finalizing the sharing of the data And we already have a set of research questions to pursue. But simultaneously, as this study goes on the, or as this study continues on the operation side, there's a similar collaboration that's happening, which is a weekly case review. And I want to pass on to Wes to briefly discuss what that collaboration looks like.
Thanks, George. So I'll be talking about a process that we've been working on for something over 4 months now. And it's a weekly review of possession of gun charges that come through our office. This is partially inspired by a project that we did last summer into this year, really, where we pulled a selection of old cases that were dismissed or withdrawn, and tried to determine what went wrong with those cases. But this is a more proactive approach where we're looking at cases on a weekly basis. It's a collaboration between us and the PPD primarily. George helps out on this. I see Chansley has joined us too, so hopefully he can yell at me if I say something wrong. He's in charge of our of this process in our office. But essentially, we're looking at cases every week to address any potential procedural or evidentiary issues on them. Primary goals here are first and foremost to get the cases right and do it properly. And that's a big goal of our office. And also for resource management, to prioritize the good cases and either remove or fix the bad cases earlier in the process. And with the note that we're, at least on the data side, we're still learning what makes a good or a bad case. That's also part of this process. And then secondarily, and more long-term goals are to adapt our policy at the DAO and PPD policy to like changing laws, best practices, and with our limited resources, with the goal of increasing the proportion of cases that are good and decreasing the proportion of cases that are bad. And for us, like nerds, develop a data set in the long term of these reviewed cases that we can study and determine what makes a good case. Are there certain facts or patterns in cases that have an impact on case outcomes? What are the correlates there? So right now we're looking at, for our case selection, any case where a felony possession of a gun was the most serious charge. If you know Pennsylvania statutes, felony 6105 is what we're looking at primarily. Any arrests with a non-fatal shooting. And then also a selection of other possession cases that the PPD request. These are 6106 cases. And our review process is we develop a script every Monday morning. It pulls these cases from the week before and sends it to a review team managed by Chansley and the PPD. And during the next 2 days, our ADAs and the PPD detectives and people who have worked on these cases review them and prepare them for a Wednesday call where we all meet together and discuss case by case what needs to happen on these cases to ensure that they're like best suited to pass a preliminary hearing. And then finally, we share notes at the end, and so this is a example of what one of the sheets look like, just to give you an idea of the data that's being collected. It's a very wide table. We're collecting a lot of different fields based on questions that were asked at certain times. And to date, we've reviewed over 700 cases, starting on the week of December 7th, and most recently this week. Major themes that we've seen so far, a lot of cases with suppression of evidence due to issues with a search. So this could be insufficient or insufficiently articulated, even probable cause for stops and searches. Problems with changes in state law. So we've had a number of pretty serious Supreme Court cases in Pennsylvania that have impacted like how searches are allowed to be conducted, and these include, but are limited to the two cases, Commonwealth versus Hicks and Commonwealth versus Alexander. And I think it's been interesting working through with the police department, how that changes what they do, so that when those cases come to court, they don't immediately face suppression issues. There's evidentiary issues, knowing what evidence to collect and how to appropriately collect it, obtaining warrants where needed. Probable cause and searches. I think another interesting theme that's come out of it is the importance of appropriate probable cause for stops and searches, but also more, I think more interestingly, how that probable cause is articulated, as I mentioned previously. Using plain language in police statements turns out to be a very important thing, because I think police have learned to use like certain like terms of art in policing, which often confuse the issue when it goes in front of a judge or a jury. And for our future work, in the short term, we're going to be looking at court outcomes. So do these reviews significantly affect court outcomes? As of this month, our felony court is in Philly is moving again. So hopefully we'll be able to see some outcomes of these cases as the next few months or year goes on. And then based on the facts of these cases that we're tracking, can we identify any patterns of cases that lead to certain outcomes? Are there certain cases that we can just say, yep, this is a good case, or no, this is a bad case? And then more long term, how do changes in our policy and the police policy, how do they change the nature of cases coming into the system? Can we get to that point where we have a lower proportion of bad cases? Can we increase that, or sorry, can we decrease that dismissal and withdrawal rate overall?
Thanks. This is me. Hi, everyone. So many panelists have spoken about the limitations of administrative criminal justice data, which are many. We also recognize that there are just limitations with any type of administrative data in general, even bringing in the CARES data, as has been mentioned. We only get to see data points where people are interacting with governmental systems. And even where we have that data, it really only shows us what's going on and not necessarily why. So this has provoked an interest in more qualitative research among us to better understand the root causes of this community violence. And we anticipate that this will be an area where public health and other city agencies and community-based organizations take more of a lead, both due to ethical and practical issues. There's information and data that law enforcement shouldn't have and questions that they shouldn't be asking, but also just a better way to elicit a richer anthropological understanding of the root causes of community violence. So looking at former people formerly involved in gun culture in the city who are now violence prevention activists or other individuals along those lines, and reaching out to them and interviewing them are of interest, among the interests of our future research agenda. And so in conclusion, tying up a lot of loose ends, many of these points you've heard either today or from the panel on Tuesday. The first one being, and I'm going to tag team this conclusion with my colleague Michelle Kilpatrick at the District Attorney's Office. But the first is that public safety and public health are really one and the same, as public safety is ultimately about protecting people from injury and death. It is a public health issue, and as such, public safety conversations really must have public health experts at the table. We need folks like Dr. Ruth Abaya from the Department of Health at the table and in a leadership role, because we know that the root causes of this violence are not going to be solved from within the criminal justice system itself. I'll pass it on to Michelle.
Hi, good morning, everybody. I'm repeating ourselves a little bit here, but I think it's an important point to drive home, but on the limitations of the data that we're working with. And so in particular, and I think both Mike and George's sections illustrated this really well, is that the data that we have access to can tell us about the relevant system. So it can tell us about the sort of outcomes as a result of the choices being made by PPD, by DAO, and other agencies in terms of when an arrest is made, when and whether an arrest is made, where police are deployed, charging decisions, whether or not a case is diverted. But what it doesn't tell us is about, as Connor said, root causes, and it doesn't tell us very much about the people involved, in particular, the people who are most at risk of being involved in gun violence, or the people who actually have been involved in gun violence. As Mike pointed out, the vast majority of those folks are people who we have no data on. And for the ones we do have data on, that data is limited to what was generated as a result of choices being made within by system actors. And so that doesn't mean that the data is not useful, as I think we've laid out pretty well in this presentation. It can help us improve those systems so we can rethink how we are or improve evidence collection practices and charging decisions, and how we are managing caseloads for both officers and attorneys. And all of those things can improve the functioning of the system. And that's very important and an important part of the work that we all do. But what it can't do is tell us very much about root causes, and for that reason cannot give us sufficient guidance to figure out prevention. And so we are trying to remedy that to some extent by, as Connor and others have talked about, getting access to data from other systems, so from systems, schools, et cetera, and from getting qualitative data, getting information from people on the ground who have firsthand knowledge and understanding of what's happening in a way that our systems are not currently collecting. But even that will be limited. And so really leaning on people who are closest to the issue and who understand what is happening on the ground in a way that our data sets can't tell us is going to be really important if we want to not just increase the number of arrests and convictions, but actually prevent gun violence.
Well said. And so that leads into the next point, which is really geared towards folks who are watching and listening, who might be interested in recreating similar types of interagency collaborations. One of the lessons that we learned from this is that successful collaboration really requires acknowledgement of each other's blind spots, not only in the data, but with our scopes of practice as city agencies or nonprofits and stakeholders in this area. There are different aspects of the gun violence epidemic that all of these partners are able to see, understand, and respond to based on the nature of the information that is available to them, and based on the nature of the tools of intervention that we have at our disposal. So really requires close collaboration and knowing the limitations of our own information and interventions to share that responsibility rather than piling all of the responsibility onto one actor. So Michelle, you want to wrap it up? I can't hear you,
Michelle, you're on mute.
Sorry about that. So I was saying, I think particularly the question of scope of practice. So as I said before, we all have very particular roles within the existing system. And those roles create limitations not only in our data, but also in what we're able to do in terms of, even once we've identified a particular problem, being able to implement the solution that makes the most sense or will be the most effective. And so really looking at the limitations that we have in the data, not just as here is a black hole of information we don't have, but using that as a way to identify the systems that need to be built or rethought in order to think about how we're allocating resources. And I think George's presentation touched on this, that we have a clearance rate that is lower than we'd like it to be. Caseload is probably a big part of the reason why. And so it may not make sense to have officers working on non-emergency situations or things that are not really a threat to public safety, and instead working on solving cases. And at the same time, even in emergency situations, making sure that the resources we're deploying are actually designed to lessen the problem. So is it providing mental health services or housing supports or whatever it might be, if that is going to go farther to preventing violence in the future than just an arrest and a conviction, that has implications for how we as a city and nationwide are deploying resources.
Now I can stop sharing my screen. Thank you, everybody. That was fantastic. So I haven't had a chance to look at questions, but if there are any questions, I'm glad attendees outnumber panelists. When this started, that wasn't the case. That's great to see. I see a question from Jerry. I can read it. Jerry, maybe I can unmute you and you can talk it out. Is that okay, Jerry? I tried to unmute you, Jerry. I'm happy to read the question too. Okay, no bother, I'll read it. So police have been criticized for engaging in predictive policing using just publicly recorded crime data, but this group appears to be including data that are arguably even more personal, such as sensitive health, school, and employment information. How would you respond to people who might complain this is an even more intrusive approach? Would anybody like to respond to that?
Sure.
What?
Multiple people can, of course. But hi, I'm Connor and I'm from the Defender Association. So from our perspective, we have, of course, been very interested in that and protective to make sure that that is not where this project would lead to. And I commend the other partners here in ensuring that this hasn't turned into sort of a big brother predictive policing endeavor using criminal justice administrative data. So we don't have the situation like in a certain county in Florida where decision makers are judging whether the likelihood of criminal conduct based on things like whether or not someone's front lawn has been mowed in the last month. So that's not what this is. And I think that we have been careful to make sure that access to certain parts of this information is appropriately controlled and appropriately used. For instance, that the information related to public health metrics is the end results are shared and shown to make these connections and suggest different correlations. But the line level data of which arrestees might have certain factors in their lives is not something that's universally shared among us. And I think ultimately one of the takeaways from this has been that we recognize the health and social factors that are tied up in the root causes of violence. And that's something to be addressed. by appropriate, institutions that deal with those issues, not necessarily dealt with by law enforcement or public defenders or anyone within the criminal justice system.
So I have two thoughts. So the first is that public health doesn't focus, generally speaking, on the individual level. And so the goal is not to say, we have identified you by some complicated metric as being at high risk for perpetrating violence in the future. And so we are now going to target you for interventions, but rather to say that the cohort of people who go on to have this particular exposure have specific types of prior exposures, and we're going to address those exposures on a population level. So how are we going to improve universal access to resources that we're seeing commonly occur in these areas? And so I think making sure that that public health lens on population level health rather than the individual length on or individual focus on who are the bad actors is one way that we take away the invasiveness of that approach. The other is, of course, having the necessary protections in place. And then the second thing I would say is that from other experiences that we have in the health department that include these extremely detailed looks into people's lives, and again, our best experiences with decedents, we interact with their families. And when we interact with their families, the concerns that are raised are almost never, why are you looking at my loved ones? Even addiction history, criminal justice history, health history, et cetera. The concerns that are raised are about what we could have done sooner. So I think that the population of people that we've been exposed to welcome a preventative approach rather than a reactive approach. And that involves having a more thorough human understanding of people that are part of this public health crisis. And so our, small amount of exposure to people who know the look that we're taking into the lives of their loved ones has not been concern about that so much as it's been concern about the factors that led them to lose their loved one in the first place.
Thank you, Connor and Ruth. Moving on, and Jerry, thank you for your response. Good answer, Ruth, thank you. And good answer, Connor, as well. So Frank's question, with regard to the good versus bad cases for VUFA, do we know, which is the gun possession, do we know if the reason is that the quality of cases on the police side has gone down, or that DAO and judges are more closely scrutinizing cases and withdrawing or dismissing them earlier? Good question. Wes, George?
I think that some of the question is exactly why we are pursuing this study. And each of us may have some hunch on what may be going on, but I think we should be looking at, or we should be closely studying it. But what I do want to mention is the significance of this VUFA case review that both departments have accomplished. Because in the past, the complaints that I've heard from the cops were that they don't find out, they don't know why their cases were dismissed. There was a lack of feedback loop. So cases get dismissed or withdrawn or what, and they don't know why. And like Frank is asking, maybe it is, apologize my language, but it may be shitty policing that led to withdrawal and dismissal. Or there might have been changes in how judges were looking at the cases. But I think what was lacking is the feedback loop, so that at least we might have been able to address those issues. But unfortunately, in the past, that was not happening in a systematic way. On the individual detectives and ADA's level, maybe. But the significance, I think, of this collaboration is that there's a systematic conversation on looking at this issue.
As a follow-up, I would add, like, it's not just that there wasn't like communication between like the district attorney's office and the police. Like, there wasn't really communication like internally to the district attorney's office. Like, we weren't tracking what actually happened to those cases like in our own office. So like we had to do like a previous like a looking back review where we pulled cases that were dismissed or withdrawn to even get an idea of why, because the ADAs would write by hand like what happened to the case on the file, on the physical file that the case was in, but we couldn't like track it in a systematic way. So that was like a backward look, and it can only get us so far with the resources that we have. Like this is a like prospective look that'll like systematize like how we're tracking this, and like we'll be able to communicate what actually happens with these cases better. It's the goal.
Thank you, George and Wes. There's a follow-up question from Frank. If through training and policy, we increase the quality of VUFA arrests, will we likely see fewer arrests and therefore fewer guns taken off the street? Another good question. Anybody have thoughts?
I don't think that would be a simple, like, one-to-one relationship. I mean, our thought on more arrests being made recently is, yes, as much as the police may want to brag about their efficiency and getting guns off the street and so forth, I think a lot of this is simply because of like more guns on the street. So unless there are fewer guns on the street, or unless there are fewer illegal guns on the street, or people stop carrying illegally guns, the numbers, I don't think the numbers would simply change.
Yeah, and I think just to add to that, I think we have to be careful about the metric that we're tracking. You know, you could break into everybody's house in the city, or you could illegally search everyone's house and find the most guns possible because you're illegally searching, but that doesn't mean that that was the best outcome in the world, right? And so if there's a reduction in guns seized because there's a reduction in arrests that were previously problematic legally, that shouldn't be seen as a bad thing. Hopefully our only metric isn't how many guns did we get. If we do, that leads to behavior that I think is unconstitutional at best, and unproductive, and possibly leading to more violence and disaffection, and feelings of danger by the community, of danger, like the police feeling dangerous to the community, and then potentially increasing gun violence.
And then I'll chime in. I think it also relates to the resource allocation question and the whole idea of like science and being able to study things. So if it's determined that like making VUFA arrests is the #1 priority, or is shown to lead to reductions in shootings and homicides, or be an effective strategy, then that might, make sense to look into more. So I think it's a question of like looking at the efficacy of the strategy, just like you would with any other strategy. And if it is effective, that means one thing. If it's not effective, if it's criminogenic, for example, then that would lead you to go a different direction. I also wanted to add, ADA Chance Lee, who runs this, has added that one other area that causes differences is legal shifts that have made stops more difficult. So cases that get thrown out may be simply because the law has changed abruptly, and it's very difficult to untrain previous behavior that used to be permissible, but now will result in a suppression. So it's also the relationship between the passage of law, and as we all know, it can take some time between a law being passed and it influencing practices. So that's another issue raised by the Assistant District Attorney, who works very closely on that VUFA case file review. Let's see. Jerry, what strategies do you hope will come out from this work? Anybody want to take that? Nice broad question.
I like that question. I feel like it encourages us to talk about our hopes and dreams for this collaborative. So I think that I'm going to speak for myself, but maybe hopefully I'm speaking for my team as well. I think one of the things that we would like to do is, with one voice, make evidence-based recommendations for city level policy changes in high-risk parts of the city. So for example, I think that there is value to recognizing that, for example, I'm going to use just one simple example: the physical built environment in which certain people are raised is a contributor to violence in that area, which is something we already know from existing data here in Philadelphia and around the country. But when the health department, the DA's office, the police, we actually partner with DVHIDS as well, the managing director's office, the mayor's managing director's office, all come together and say, we have evidence to suggest that we think that this is useful for our city. And we would like with one voice, and our leadership would like with one voice for us to invest in this more significantly. And we're going to follow those investments with outcomes and figure out whether or not what we're doing is effective. And we have the data support to do that. I feel like that has the ability to move the needle in a way that's harder to do if you're just, the Horticultural Society trying to do greening on your own without that kind of collaborative support. So that's one thing I would like to see happen, is to come up with a uniform set of neighborhood level evidence-based recommendations that we can track over time with data and that we can with one voice advocate for.
And I would add, Connor spoke briefly about some of the qualitative work that Dr. Obaez started working on and partnering with external research partners on. And I think some of that work will be really informative for us in thinking about some of the programming that we offer as a city and target to, high risk and vulnerable populations who live in these kind of high risk neighborhoods, and how some of this information that we can't necessarily cull from a lot of the administrative data might be able to better inform overall the city's public health approach, but especially those that are targeted towards violence prevention and towards how do we serve those populations much better when we kind of have a much more nuanced and robust understanding of the issues that those individuals face when they were previously involved in violence.
Those are great points. I'll just add that I think in many jurisdictions, the police analytical shop is the largest. So I think one thing that this also does is, working collaboratively with the police, help other shops, analytical shops that might not have the same resources as the police, kind of work together. And really, it's just like, it's communications in many respects, and it's the narrative. So if the narrative is dominated by a more public safety approach, then part of this is also lifting up how public health can work and how public safety equals public health. So it's also just getting data people together who can collaboratively put together different narratives and different analyses. So there's one more question, and this might be the last one, unless there's a short one that comes in after. It's another really good one. Mark, thank you. In what ways did the results of the study and collaboration surprise you rather than reinforce hypotheses? A nice question. Does anybody want to share their thoughts?
I can share a couple of things. And I would say that all of this is a little bit limited because, as we've talked about, we're really in the early stages of what we think is the broader and more thoughtful approach to this, which is looking well beyond just criminal legal data, which is what we have our hands and our minds around the best. So the CARES match is new and early, and we're still working through and learning what the data in the CARES match is. And then the idea of connecting to people in the community is also still something that we're in the process of, and we have a lot to do. But on the criminal legal side of things, I think the two things that were somewhat surprising to me, I guess, is one is what George highlighted earlier and Wes spoke to as well, which is the past failures, I'd say, or just not having really systematically thought about how to communicate both within the district attorney's office about what's happening with cases and why there might be a reduction in the conviction rate in certain types of cases, and then that communication between the police and the district attorney's office, so that if we're seeing things systematically, we should make sure that the police understand that, and we can help and work with the police to change that. And then the other piece, at least for me, was the work that Tyler and George did together, and looking at clearance rates and thinking about what some of the factors that go into the clearance rate are. And the idea that increased shootings decreases clearance rate in a time period when you think about it, makes sense, but just the idea that a lot of this might be about resource constraints within the police amongst other problems, but that's potentially a large factor was something that I hadn't thought of before, and I think it's really important. And it's also helpful because that's something that we have control over. There's lots of things that we don't have control over, or our control is very weak. But certainly thinking about how the police deploy themselves and where they focus their attention, where they put their most experienced detectives is something that we can control, or at least the police can control.
I'll just say really briefly that we've just begun interviewing violence prevention advocates, and there are a myriad of surprises there, as always happens when you start to get into more qualitative data and lived experience. And so I expect that as we do more in the qualitative world, there will be a lot that surprises us, which is exactly our objective. So I wanted to mention that as well.
I think we have time for one last question because it's a good one from Professor Roman. Will you all be presenting some of these findings at the city's bi-weekly briefings on gun violence? There is a huge benefit to having city residents know the specifics of what you are doing and how it will benefit residents in both short-term and long-term. Anybody have thoughts, or just a nice comment?
I don't know that we've ever discussed that now that those briefings have been announced, but I completely agree that we have to think about a way to make our work as we develop it externally facing and in that way accountable to the public. And the briefings could absolutely be a good way to do that. We have not been extended a formal invitation / invited ourselves to that effort, but I think that finding ways to make sure that what we're doing is being communicated more broadly is critical. Completely agree.
Yeah, I mean, I'll second what Ruth said. So there's certainly decision making that is over all of our heads about what's presented at those meetings. But I think one of the things that those bi-weekly meetings do allow us to do, and will, I think, be the focus, especially of a lot of what comes out of kind of the MBO side of that too, is how we're really trying to better collaborate across the city in terms of tackling gun violence, and really talking about the work that not just this group is doing, but we're doing across, the city as a whole in other avenues in terms of better informing the public of how we're thinking about and approaching the problem of gun violence. But your point, Katerina, is well taken. And yeah, as Ruth said, we haven't in our group talks, about presenting out on that, but that's certainly a possibility in the future as we kind of get farther down the line with this work. So thank you.
We are pretty much at time. So I want to thank all of our panelists and all of our attendees for the great presentations and the great questions. Thank you so much for your engagement on this Friday morning. And thank you everybody for attending the Law Enforcement and Public Health Conference. Hopefully this group will be presenting at future law enforcement and public health conferences that are not virtual and maybe are in other countries, as I understand that is the custom with these conferences. So thank you everybody again for great presentations. If you have any questions, please feel free to reach out to anybody associated with this panel. And thank you all for your collaboration. I think it's been really helpful and productive, and I look forward to continuing to work with you all.
Thank you, everybody.
Take care,
Thank
everybody.
you.
Bye, everybody. Thanks.